So we're actually moving to the next session of today's very packed agenda. And I am very honored that the Global Observatory of Long-Term Care is very honored that the World Health Organization has wanted to feature their work in today's program. And I think it's a great recognition of the effort that WHO is putting into providing answers to countries on long-term care as well. It's always interesting because long-term care can fall under so many different international organizations, and I really appreciate the efforts of WHO and their engagement. So we're going to start with a presentation from Hyobum Jang from headquarters in Geneva. Hi, Hyobum. And he'll be talking about long-term care in the global policy agenda. If you want to share the screen yourself, if anyone needs help, let us know. Thank you.
Thank you. Nice to see you, everyone. Thanks for inviting me to this great webinar on this important day of International Day of Care and Support. I have seen the previous sessions, which are very informative, and looking forward to communicating and collaborating with you. So guessing I have only 5 minutes, I will do quickly. So yeah, it's my also honor to start this session. WHO's work on long-term care. Let me just briefly provide you the background and overview of our work at the global level. So many of you are aware of the UN Decade of Healthy Aging. The concept of WHO's healthy aging started in 2015 when WHO published the first world report on aging health. In this report, the concept of increased capacity and functional abilities were introduced, and that changed the concept of long-term care as well. Although still there are many perceptions from countries and different countries that long-term care is usually about the older people or in the long-term care facilities, residential settings. In terms of WHO definition, long-term care is provided when people have lost their increased capacity significantly, and when they need support to maintain their function ability. That includes some kind of services to maintain and also slow down the further decline of functions and capacity. So long-term care has been since 2020, when the UN Decade of Healthy Aging started. It has been one of the 4 action areas to provide access to long-term care for all the people who need it. And since then, WHO has published 2 major publications: the framework on long-term care, which is to guide countries to assess their long-term care situation and build long-term care systems. And this year, we published a package of long-term care interventions, which also provides guidance that countries can consider to integrate essential long-term care interventions into their UHC or essential benefit packages. Now we can see the global momentum since COVID-19 pandemic, especially there has been very surging interest from the member states in developing their long-term care systems and policies facing the emerging care demands. And countries would like to share and learn lessons from each other, recognizing there's no perfect model. All the system has some weaknesses after COVID-19. So this Global Observatory of Long-Term Care platform is a very good platform to learn about other countries' models. And also there are a lot of interest in financing long-term care, as we just heard from the previous session. WHO is providing a global level coordination function. It is partnering with other UN agencies through interagency platform to implement the UN Decade of Healthy Aging. And we are trying to organize a UN-wide working group on long-term care and also coordinate multi-sectoral collaboration. Including Adelina and many participants in this webinar, we have a very good vast network of advisory group with international experts within countries. We are having consultation exchanges with them. We call it Global Network of Long-Term Care. And although this is still emerging area of work inside WHO, we are trying to expand our country-level support to implement long-term care. One good example is supporting China with their long-term care insurance policy. we provided training workshop, and then we're gonna continue the high-level policy discussions with the government and experts. In the future, especially, data will be very crucial. OECD has been collecting and providing data from OECD member states, but WHO is also trying to collect more significant data on long-term care from countries and practices. And we try to make a global report on long-term care, which we hope to show the realities of long-term care in countries and to provoke transformations in long-term care systems. I briefly introduced the two major publications I mentioned before, which the first is Long-Term Care Framework. This was published in 2022, and it has providing six components of long-term care systems that you can see similarities of WHO health system strengthening framework. So it can be used as a checklist and the implementation list to assess and implement long-term care systems. And then we've been thinking about how long-term care could be integrated in WHO's major program on universal health coverage. So when considering long-term care insight in the context of UHC, we think that we need to really expand the three dimensions of UHC to include more target population, not only older people, but also unpaid family caregivers, and also extending not beyond the health systems and services towards social care and protection, and also to integrate a person-centered service model rather than just adding more interventions. So within this, with this aspiration, we published a long-term care package for universal health coverage this year, which we wanted to help countries to allocate more resources as they can see the specific list of long-term care interventions. We consulted many experts in countries to make up this list of interventions, and we hope this package is also helpful for countries to see the needs of unpaid family caregivers and their health and social needs as well, and to provide some of the training for them based on the education training topics in this package. So this is the brief structure of this package. We provided 3 groups of core interventions to address healthcare needs, palliative care needs, and social care and support needs. We provide 2 facilitating factors based on person-centered integrated care model, which is aligned with the WHO's integrated care for older people approach. And we provide some topics for education training, not only for health and care professionals, but also carers. There are so many things to be done as you are also hearing from today's webinar. But if we think about WHO's core role at the global level to move for long-term care agenda in global landscape, we are thinking of a few priorities in the next years. The first is long-term care standards, since definitions and standards are very different across countries and settings. We try to collaborate with multiple entities and including UN agencies to review and agree on long-term care standards, hoping that it could serve as a standard for data indicators and also quality standard on services and long-term care settings. And there's also a huge need to provide some kind of training and support for carers as well as long-term care workers, especially seeing the needs of women family caregivers in low-income countries. So already many regions and countries are developing some kind of training modules for informal carers. The WHO at the global level will consolidate this and also build some more framework, including competency framework on long-term care. And as I mentioned, countries want to really share and learn from other countries about the lessons, policy models of long-term care. So yeah, like the main partner, like a Global Observatory long-term care, we will collaborate with many institutions and stakeholders to consolidate this information and hopefully consolidate into a global level report to share this information and models of long-term care. Thank you. Over to you, Adelina.
Thank you so much, Hyobum. And now we're going to go to hear about from the Europe Regional Office of Care from Stefania Ilinca. Stefania, all yours.
Yeah, thank you so much, Adelina, also from my side for organizing this brilliant session. I can't think of a better way to celebrate the second day, International Day of Care. And thank you for making space for us. Thank you for your support, not only today, but throughout the year. We really, really rely a lot on the expert of experts that you've created around you. And many, many thanks and my congratulations. I'm going to be talking very briefly about some activities that we are undertaking currently at SEARO, and I wanted to introduce the team. I'm speaking today alone, but it really is a team effort. And here is an overview of the work priorities that we have set for ourselves in consultation with member states in the European region. And let me remind you, there are 53 member states in the European region. So in WHO's definition, Europe goes way beyond the span of the EU only. It includes the Western Balkans, Central Asian republics, and Eastern Europe as well. And countries in the Caucasus. So about 2 years ago, when we started ramping up efforts on long-term care, we had a series of consultation with focal points, and these were some of the priorities they identified. We took this very seriously in our work. We've started on a few of these aspects, and we very much intend to cover all of them in the next year. So in the next European work program for the next 5 years, we hope to see all of them reflected. And I've highlighted here the care workforce and informal caregivers, because in the intervening years, priority in these two areas has only increased, and we also intend very much to increase our efforts. A big area of work for us in WHO Europe remains the partnership with the European Commission in support of the European Care Strategy. We have two main objectives under this partnership. I'm going to talk briefly now about the first one, which is appraisal and monitoring of long-term care systems in support of reform processes. And I'm going to leave the second one for the second part of the session, and that focuses specifically on information and training for informal caregivers. But as regards appraisal and monitoring of long-term care systems, we are now very close to the launch of a set of flagship publications. Again, a key deliverable for the European Care Strategy, also a key deliverable for WHO Europe in setting its own work priorities in long-term care. We call it the State of Long-Term Care Toolkit. It is a series of publications that provides a conceptual framework for monitoring and continuous learning in long-term care systems, which we have accompanied with a glossary, a first attempt from us, from the Commission, together with a group of experts who have been incredibly patient to propose a common terminology. We understand this is just the first step, but we'd be very interested to hear from you and to improve this glossary as we go. We also produced an implementation guide, although we do expect and hope that WHO Europe and the Commission will be able to accompany countries in undertaking this assessment. And alongside the implementation guide, a data collection template, which offers a synthetic, we hope, but still complex set of measures that can be used in system assessment, going way beyond what can be seen as just, a simple statistics or indicators assessment framework. We have also produced 3 national reports as we were developing the framework as pilots and as test assessments, and these will all be launched on November 12th in Brussels. Let me say just a few words really about how the framework is built. We're very much trying to keep equal emphasis on the population needs for long-term care, to which the long-term care system is called to respond, but ultimately on the impact that the long-term care systems have in society beyond the specific outcomes of care. So in this complex cycle that goes from needs to inputs, outputs, outcomes of the system, and ultimately population impact, we think it's really important to keep in mind what it is we do, what we do, and always refer back to what matters to people and to communities. And I will say one more word, if you allow me, on the long-term care system, the state of LTC framework. It's very much not only a framework for assessment, but really an approach for participatory assessment. We have the ambition with the methodology we are proposing to not only build a strong evidence base, but really provide a platform for generating consensus and for building trust, because we see that more often than not, barriers to reform are not linked to gaps in knowledge and data, but they are linked to difficulties in coordination, weakness in alliances, and difficulties to really come together, let's say, across sectors, across settings, and identifying a common vision and identifying a common direction for action. The second important activity that I would like to signpost, and I'm very, very happy that I can announce this on the International Day of Care, we have the ambition at the European Office to produce a state of long-term care in the European region report. This will be the first regional report on long-term care, and we're hoping it will be an opportunity for us to focus on healthy aging and long-term care needs with a strong prevention-oriented approach, but also talk about long-term care service coverage. So raise the alarm a little bit about who is covered, what is covered, how much is covered, and what gaps there are in financial and social protection, aligning a little bit the discourse on long-term care with the universal health coverage agenda. We also think this is an opportunity for us to step in and make a strong statement that investment in long-term care systems can reshape the challenge of population aging and can really be a step changer in how we age now and in the future. The last thing I want to talk about, again, very, very briefly, is an attempt to say a little bit more and produce some structured information on quality management and long-term care. You'll hear a little bit more about this in an upcoming session, so I'll be very, very brief. But just to say, it's an area of work that we feel is essential, because promoting development of service capacity without a good understanding of what quality is, how we can encourage quality, how we can promote it, how we can monitor it, can be counterproductive. So going forward, especially because we make strong calls for diversification of services and an emphasis on community-based care, we strongly believe this needs to be accompanied by good, reliable guidance on how to achieve good quality care in all care settings. This is the definition we're proposing, and we are also going to be publishing very soon, I think in the beginning of December, a series of accompanying country example and vignettes, which can, hopefully give inspiration about how these principles of quality management and long-term care can be put in practice. We do hope that this will be just a first step in a developing area of work for quality management and long-term care. I'll stop there because I don't want to steal time from my colleagues, but hopefully I'll get some questions and we can come back to some of these details. Thank you.
Thank you so much, Stefania. A lot to look forward to in the next few months, in days even. Now we're going to go to the Pan American region, and Patricia Morsch, the floor is yours.
Thank you very much, Adelina, and thank you very much for the opportunity to share these experiences with my WHO colleagues. And congratulations for the event today. So I would like to share a little bit of the long-term care priorities and initiatives in the Pan American Health Organization, which is the WHO region for the Americas. So I would like to mention first that PAHO has been for a long time working towards improving long-term care, and especially calling attention to the importance of the involvement of ministries of health in working towards improving long-term care and preventing care dependence. And this has been a work mainly with the Healthy Aging program in PAHO. So since 2020, in the launch of the PAHO strategic plan, we do have an impact indicator, which is the proportion of adults 65 plus who are care dependent. And this is supported, like this results of this impact indicator would be achieved by the outcome that we have on quality care for older people, and the outcome indicator on number of countries and territories with capacity to prevent care dependence. This has opened the opportunity to work with the ministries of health in adapting their health systems, mainly on the prevention of care dependence and working towards an integrated care for older people. And of course, also open the discussion about the difficulties on working on long-term care, working with intersectoral, with the other sectors that provide long-term care in our member states, and also related to how to measure long-term care, and especially this care dependency. So this impact indicator has been very challenging in the organization to measure, because it was identified that many countries didn't have the information related to care dependency specifically. And this, with this in mind, PAHO started to work with different agencies, with different groups, trying to find ways to, one, measure this indicator, and second, stimulate the countries to start measuring this in their national surveys and research. So based on this work, PAHO proposed for member states a policy on long-term care. And this policy was approved by member states in the latest PAHO's Directing Council, which was in October, in the beginning of this month. Member states approved and congratulate and were happy about the development of this policy. And this policy has the objective to provide member states which is strategic and technical guidance for the development, strengthening, and expansion of long-term care in the countries. Of course, establishing the needs of each country based on what the country is already developed, their state of the development of long-term care, and from there strengthen the different areas to improve coverage, to improve quality of care, and to provide better long-term care. So this policy will be in place from next year until 2030, and we'll have the results presented in 2028 and a final report on 2031. And this policy has 5 main lines of action. And this is going to be our main work with member states to support the development of long-term care. The first one is to strengthen governance, accountability, and stewardship towards intersectoral policies on long-term care. And this one mainly establishing the important role of the health sector to be working and to be part of these care policies that are being developed in our region, and their role in providing long-term care, but also on the prevention of long-term care. The second one is strengthening workforce capacity, and here we are talking of skills and training and valuing long-term care workers and also informal caregivers with the support they need in the community. The third line of action is strengthen the organization and delivery of person-centered care, and this mainly related, as Stefania was talking about, the quality of care, person-centered care, and helping the countries to identify ways to delivering this continuum of care that goes since the promotion and prevention, and also end-of-life care, and also, of course, monitoring, like how this care is being provided. The fourth area of action is increase and optimize sustainable and equitable financing. And you already discussed that a lot in the previous session. And the last one, strengthen information systems for long-term care and improve data collection and research. For the policy implementation, PAHO is already working in different strategies. One of them is a policy brief series in the topics related to the lines of action. What we understood and we could see in the development of the policy, that it came along with like different consultations with different groups, with member states. We were happy that our team, the Adelina was there too in the consultation and the development of the policy. We could see that there was a lot of misunderstanding on what long-term care is and how we can implement and how we should work towards long-term care. So the first action of like PAHO is undertaking is this policy brief series to describe a little bit more on what exactly each area of action means. So for example, the first one is integrated and person-centered long-term care. So how we can, what that means, like how we can develop that, case examples from the countries. And so the countries would have an idea on how to implement each of the strategic lines that we are proposing in that policy. So the second one is about long-term care workforce. The third one is about governance and financing. We put them together to optimize the work. And the final one is about this integrated continuum of long-term care and this array of services and practices that we need in long-term care. We decided to do the information systems and research as a transversal topic for each of the policies and not having one separate policy on the data. And this is an interagency collaboration. We have many colleagues and many agencies from United Nations, from the Inter-American system, supporting the development of the data, providing suggestions and reviewing. And of course, bringing case examples. We are trying to bring examples from Latin America, mainly because a lot of the knowledge that we have in long-term care is from high-income countries. We are learning a lot from Europe, from all the work that Stefania is doing and the headquarters team. But we need to find also the ways and the examples, because we do have, but we need to put them together and make them available to encourage more countries from our region to work towards a long-term care. And we are also working as part of like a consortium on a caregivers virtual course. It's going to be a platform for caregivers to increase their skills, especially on like person-centered care and responding to the needs of the person, of the individuals that need care. So this was a call of the regional public goods from the Inter-American Development Bank. And we participated with the Astor Foundation, which is going to be the foundation that is going to execute the project along with 6 countries from our region, and along with the IDB, PAHO, INSERSO in Spain. We are going to be the strategic partners for technical information and support for the countries and the foundation. This is a 2-year project starting next year, and hopefully we'll have soon this platform available online to support caregivers. And of course, we always work with the different regions and PAHO for itself for resources to provide information to member states on where we are and what we have to do in long-term care. So we do have different publications that we work with different agencies or even like with researchers, but also we work with translation of the main documents that headquarters published. For example, the 2 documents that Hyobum presented in his presentations, we have them available in Spanish. The framework is available in Spanish and Portuguese. The package is going to be available in Spanish soon. And we are also working with Sarah Barber, who was participating in the previous session, on translating the financing briefs of the WHO Kobe Center in Spanish and Portuguese, and it's going to be available, the 10 briefs, in these languages until the end of the year. So this is on the PAHO perspective, and I'm also here to answer questions if we have. Thank you.
Thank you so much, Patricia. An amazing progress and amazing milestones you've achieved this year. It's really great to see how the pace has really picked up in the Pan American region. It's great. I know we actually have an intervention from Sarah Barber on supporting unpaid carers in low and middle income countries. So Sarah, you're back a bit earlier than you thought.
Thank you very much, Adelina. Let me just share my screen briefly here. Thanks so much. I'm delighted to join again, and thank you again for inviting me to talk a little bit about our research on supporting informal caregivers, which is part of our research brief series and that we've done in cooperation with our colleagues from the regional. And congratulations again, my big, terrific work always done in the regions in PAHO and in EURO and in all the regions who are doing incredible work in implementing these policies. So I'm just going to talk a little bit about recent studies that we've done on informal caregivers, and just to emphasize the importance again in low and middle income countries where we do see more and more people growing older, as well as people who are facing age-related problems younger than 65. So the importance of actually identifying biological and chronological age, and the importance of recognizing needs among people, among older people as they age. So we did do the 10 briefs. Again, I'm just going to focus on this one on the last brief, supporting informal caregivers. For this brief, we conducted a systematic review of evaluation studies, and that review focused primarily on 4 interventions, which is investing in public long-term care services, the substitute for informal care, labor force policies, particularly for working age informal caregivers, cash benefits, as well as training opportunities. So while informal caregivers are present in all countries, they do fully substitute for formal long-term care services in countries where there are few or no publicly funded long-term care services. So relying on informal caregivers is sometimes viewed as policymakers as a kind of a simple or a cheap solution to reduce the pressure on public long-term care services and address the needs, the growing needs of older populations and persons with disabilities. And this is particularly so in low and middle income countries, where countries may fear that they cannot afford to invest in long-term care services because economic growth is anticipated to slow with population aging. However, not investing in long-term care services does not address the demand. The demand still exists, and this simply means that the cost of providing care is shifted. It's shifted to the family, it's shifted to the community, and the services are shifted to the health system. So ultimately, by not investing in long-term care, the negative economic impact of aging is compounded, because you're not only facing the pressures of older people leaving the workforce, you're placing pressures on informal caregivers, particularly those of working age, to reduce their workforce participation, or in some cases leave the workforce. So even in countries that value traditional caregiving, as we heard earlier, with the decline in fertility ratios globally, it's really becoming less and less feasible to assume that informal caregivers will be available to provide care. And we looked at, in some of our research, we found a number of studies that have estimated caregiver time and effort, and we found that there's a very high value of informal caregiving to the economy, ranging from 0.8% to 4.9% of GDP annually. So there is an incredible value of informal caregiving. There are 4 main interventions that we found that countries are using to support informal caregivers. The first is investing in formal public long-term care services to substitute for informal care. So countries have provided daycare services and meal services, for example, so that working age informal caregivers can go to work during the day. In addition, employers have offered both paid and unpaid leave to care for family members, as well as there are systems of flexible work arrangements that can help informal caregivers to balance informal and paid work. Many countries provide cash benefits either to caregivers or care receivers, and cash benefits to caregivers do tend to be slightly better managed and regulated, and are used in some cases to formally recognize the contribution of informal caregivers to the care economy. The impact of cash benefits provided to older persons directly is not as clear in the evidence that we've seen, and I would note that there is some evidence to suggest that cash benefits may pressure women to remain in informal caregiving roles. And lastly, there are many training programs for informal caregivers, particularly those that provide intensive caregiving services for people, for example, for people with dementia or people who have experienced stroke. However, and in some cases, these trainings are very impactful where you link people to available services in the community. However, there is not a lot of evidence that training alone in isolation of other policies and programs is as impactful as we have expected. So that is all from me. You can access all of this information on our website, wkc.who.int. Thank you very much.
Brilliant. Thank you very much. And I think we have time to hear a bit more from Stefania's work on, sorry, let me just get, I was just checking if the other speaker had been able to join us, but we don't see her yet. So we're going to hear from Stefania also on some work they're doing at WHO Europe on training for informal carers.
Yeah, thank you so much. I guess what I would like to start with is that what I'm talking about now is all work in progress. We really welcome help for everyone on this call. This is a set of activities that we are making every effort to coordinate with on across the regions. You have heard Sarah talk about it. You've heard Patricia talk about it. And while we each have our own set of activities, we're trying very hard to pull the strands together. And there might be different deliverables, but hopefully they're all be aligned and coherent. We understand they still don't cover the entire global space, but hopefully with your help, with your input, with your commentary, we can be as inclusive as possible and make the outputs, the materials that we produce, as relevant as possible around the world, because clearly there is a need. And I will pick up from Sarah's last message that training alone is not enough, and we very much know this. But at the same time, we understand that having access to information, to the right information, and signposting of further services can be really important for caregivers. They give them the confidence, they can give them peer support, they can give them trust in what the next step might be. And we strongly believe that we can help here, not by reinventing the wheel. The first step we've done in preparing for producing this product has been to do a mapping of the landscape. So only looking at the European region, our expert collaborators have identified in really just a quick sweep over 90 online available platforms that provide training and information for informal caregivers. Had we truly gone global and had we truly done a multi-language review, I'm sure there would have been many hundreds of sources we would have found. Now, this is not to say that all have the same quality, the same validation, and the same precision behind them, but there clearly is a lot of information. So we strongly feel that the challenge is in curating evidence-based, strongly validated information and hopefully presenting it in a way that that can be useful, not only for people who have or expect to have care responsibilities, although they will remain our main target audience, but also for what we call multipliers. So hopefully the materials we produce will be useful to caregivers associations to support them to develop materials for in-person trainings or for peer-to-peer support session. We also hope they can be useful for public authorities who can use this maybe to develop national guidance or to develop their own support materials, financing projects, innovation-oriented initiatives. So really, we're just trying to, again, establish a repository of knowledge that already exists and hopefully present it in a way that's as relevant as possible to a broad set of stakeholders. Now, I want to also emphasize that we understand that there is a lot of information that's equally relevant everywhere, because caregiving is a very human activity, but there's also a lot of information that is very context specific. This is something that we will try to balance in the way we develop the material, and I'll talk a little bit about that. So after a bit of work, building on the evidence that exists and the advisory group that we have created, we will be building as a general structure into these 6 core modules. We'd like to start with information around long-term care needs, healthy aging, and caregiving. Provide advice on how to manage specific challenging situations that might arise in the care process. But by and large, the core of the training is really split into main types of activities: how to strengthen competencies to provide care to others, and how to strengthen competencies for self-care, so that in the process of care, both the person who receives care and the person who provides care are protected and are supported. And this is very much the ambition we have with this. Now, while we think that these general 6 blocks themes are relevant everywhere and are essential information that can be generalizable, we also recognize the need to complement this with country-specific information, ideally in national languages, that signposts, first and foremost, what are the entitlements of caregivers in different countries? What are the services that they can rely on? What are some country-specific sources where they can go to deepen the information they receive or to access further support? So on top, or rather under the 6 core modules, we hope to develop country-specific vignettes, and we're certainly going to start with a subset of European countries. But the ambition is very much that in time, these resources would be expanded at global level. And this can only be done, and this can only be kept updated with the help of a network like the one that we have here. So this, again, is my call for collaboration and support as we develop this work in the future. Now, my slides are stuck. Now, I want to end on this slide, and I would leave it on the screen to give you a chance to look through some of the key topics that in our expert validation activities we have identified as essential in all in the 6 modules. And hopefully, while I let you look at this for a few minutes and process it, Adelina can help me with audience poll that we have prepared, because we'd really, really like now, if you'd be willing to engage with us, as you read through, please write to us if anything glaring jumps at you as missing, because if that's the case, we're still very much in time to include it. So this is your first opportunity to provide feedback, and I can promise you that this feedback will be taken very seriously. It will be helpful for us in our work. So I'll leave you a couple of minutes to just go through, and if any ideas come as you read for anything that's missing, please put it in the poll that is now at least on my screen.
Thanks for confirming it's on your screen. We always wonder whether people can actually see it.
It is on my screen, yeah.
Excellent.
I will not answer. But,
so feel free to answer. I know it's very late in the day for some of you in Australia who's still here. So if you're a bit tired to answer, we'll understand.
And I should also say that there'll be, again, my email at the end of the presentation. If you can take a snapshot of the screen, think through and come back with suggestions in the next days, we'd really be happy to hear from you. Again, I know we're asking your time, but this might be something that's reflected in your work. We'd also welcome recommendations of platforms that we should be looking at and we should be considering in the developing of material that might be, not in English or, outside the European space. This is also something that we will be expanding as the work expands.
Thank you very much. And while we leave the poll, if anyone would like to ask any questions of any of the presenters that we've had in this session, we have a few minutes. And I see we have a comment saying helping families navigate local health and social care resources. And think we hear that quite a lot. And yes, thank you. I just got a message with some of the answers. So far we have palliative care as an ongoing and support on the transitions towards palliative care. We see physical therapy for stroke, dementia care. Another one is navigating interfacing related services. So yeah, another support with wayfinding, dealing with administration. Yes, when a spouse died, for example, how can the older person care manager deal with that, and what do they have to do, what to expect, loneliness and social isolation, on being a carer, balancing childcare, adult children, parents, older care with emergency situations, and how to deal also in the case of having environmental as well as health emergencies. And the chat box, I can see a few more. So
yeah,
fall detection and prevention. Many carers are also older and frail. Self-care for carers. Teaching informal carers to be able to ask and receive respite. And I got a few more on an email. Let me just get that for you.
This is great.
And we'll share that with you at the end. Stefania, you don't have to take notes, don't worry.
Yeah, please keep them coming. This is fantastic, and I'm sure there is going to be a limit to how much we can pack in one course. But this is certainly a good to-do list for us. And one thing triggers me because I see mentions to dementia and to fall detection. I think another key goal we have with this training is to signpost condition-specific resources, disease-specific resources that already exist. So while here we'd really like to be as broad as possible and talk about care irrespective of what is the underlying condition that leads to a care need, it's also the perfect opportunity to highlight there are many specific resources that might be right for you. So this is very much something that we will be trying to incorporate. So thank you for that. And please keep the suggestions coming. So I'm going to go to the next slide. Can I? If more ideas come, don't hesitate to write. We'd really be very curious to hear from you. Thank you.
And we will collect everything that's in the chat and in the poll and send that to you at the end. And we can also add the summary of the poll when we actually have the video to share of the session. So feel free to keep writing. If there any other question for the speakers in this session from the different regions and also from the central office in Geneva, please feel free to raise your hand. Maybe Stefania, if you stop sharing, we can see if people show their cameras. Thank you.
Can I just say something about the caregiving? And Stefania and I talked in different opportunities because we are trying to learn from each other and of course share the information to don't duplicate efforts. What in PAHO we are trying to highlight also is this care needs over the life course. Of course, all the long-term care strategies and here are being motivated and worked by the Healthy Aging program, but we understand that the care needs might arise at any stage of the life course. And these people that are in need of care, they are living longer as well. And of course, their caregivers are many times being a caregiver for longer. So we do have, and maybe the resources that they will need will be one in one moment, and then it's going to be another after, another moment of the care and the needs of this person. So I think this is also very important to be aware of and to have these different tools, considering how these trajectories can fluctuate and can change over time. And I saw on the chat also like a group with like young caregivers, which is great. And Stefania also has it highlighted in the group, but I also saw the other comments on like how to self-care for older caregivers, as we do have a lot of them that are older and also have their own needs as well. So I think it's a fascinating topic. There is so much to do, and we are happy to work together and of course receive all the suggestions that the audience and the groups have. Thank you.
And you have reminded me, Patricia, that here at the Observatory, we have an interest group that I'm just putting on the chat that's called Employment, Education, and Family Caregivers. So this is particularly focusing on the issues faced by younger carers. It could be people who are in work, in education, because caring can start really, really early. And I did see that we have representation from Lorenzo's house, which is a fantastic project supporting people affected by dementia at very young ages. We've got another 5 minutes, so you can ask questions to speakers. You can also add anything that you didn't quite have time to say while you had your slots, and I'm watching for any hands or additional comments. I see also that Patricia makes a point of the importance of also not forgetting that unpaid carers are also involved in care homes, and maybe the people who experiencing this transition and want to continue to involved in care once the person, their loved person is, sometimes it will be their spouse is moving into a care home, sometimes find it difficult to be able to continue what they did before and the support that they were providing to each other. And so it's a particular group that I think quite often we forget about. Looking for more comments. We didn't say good night to Janine. Janine's been here all from the very beginning, from Australia, and it is really late where she is. Thank you, Janine. I see here that the importance of care networks, including people from civil society, comment by Denise Razuk, and the importance of training volunteers, NGO, and Instagram influencers, I think, and TikTok, let's not forget that, and disseminating good information and also, you know, providing care. Is there no more? Oh yeah, I do find, Will, do you want to unmute and say hello and make the question yourself?
Oh, okay. Yeah, so the question is, what do you find are the biggest challenges to policymakers to pay attention to long-term care? So I'm kind of asking as a young person with minimal policy experience, but kind of on behalf of young carers of dementia care, because they're all wanting to make a difference and wanting to know what they can do to help accelerate change.
Can I jump in there? Will, so good to see you again. You're much more than just a young carer. You're a fantastic champion. And thank you so much for the work you do. I think that's exactly what's needed. And the big message that I hope my colleagues will agree with me needs to be transmitted is that long-term care is everyone's business, that this is not about older people, frail people, only nursing homes. This is really everyone's business. It affects all our lives. It's about gender equity. It's about intergenerational equity. It's about all the good things that we want in our society. And this is such an essential core investment that we need to start with. So honestly, what I would like from you and from people your age is to get in the game and to talk about it. And yeah, I understand it's not always easy and that some stigma is still very much attached to it, but we certainly need brave people like you. Thank you.
Thank you. And and there's also another group we often forget about, which are the parents of children with disabilities, for whom unpaid care can be a lifelong occupation, and who are often, you know, after so many years, accumulate so much economic disadvantage, and quite often are not included in policy, because we often think, again, as care for older people, or maybe for people with disabilities who are all adults. So I think it's important that whether we look across the whole life course. And we all start aging since the moment we were born. So I do think taking this very broad view is very important. So we're now going to...
Can I add something very quickly, Adelina?
Yes, Patricia.
And thank you very much for the question, Will. I think, as I said many times in my short presentation, is like how the work is trying to call attention to like the health sector. And because traditionally long-term care, at least in our region in PAHO, has been mostly provided by social development, by like for vulnerable people. And so this is like the main, for WHO point, I think it's calling attention to health sector, that long-term care, as Stefania said, is everybody's business, including health. And health has the main goal has to be to prevent care dependency on one hand, through the services that they provide, having this view of care dependence that it's possible to prevent. And on the other hand, support these people in need and the caregivers who are in the community. So like engaging primary care with long-term care and this continuum of care, it's very, very important. And this is the message that we are trying to bring to our country counterparts.
Thank you so much. And with this, we're going to bring this session to a close. It's been fantastic to see this work. It's fantastic to see the energy at WHO in addressing these really important issues and the work with other agencies. And I do think this is such a great move. And it's fantastic to see what the next 5 years for many of you are going to bring and all the impact of all this work you're preparing at the moment.